and my fans and my students everywhere. This is Professor Dr. Tarek Ali. Today, this is a live broadcast for healthcare professionals, doctors, physicians, and surgeons, and those working in the clinical fields. We all know that medicine is a science, and as I mentioned before, medicine is a science of uncertainty and an art of probability. So medicine is a science and an art. It is a science of uncertainty and an art of probability. يعني الطب هو علم وفن، وهو صناعة من الصناعات الدنيوية. And there is a difference between medicine as a science and medicine as a profession. There is a difference between medicine as a science, that is medical knowledge, and medicine as a profession, that is the medical profession or the healthcare profession or the medical practice. And the more we can and the better we can fill the gap between medicine as a science or as a knowledge, that's the medical knowledge, which we study and we learn as students, or we teach as medical staff in the medical universities or in the medical colleges. This is the medical knowledge, including both the basic sciences and the clinical sciences. This is called the medical knowledge or the medical science, if we use the word science and knowledge as synonyms, in spite of the fact that I mentioned before that there's a difference between as a terminology between by definition between knowledge and between science. But if we consider them as synonyms, okay, so this is medical knowledge or medical science, which we get and we study in the faculty of medicine or in the medical schools or in the medical universities, whatever the name is in the different parts of the world, in order to get qualified as doctors or as physicians and surgeons, or as general practitioners. And then after that, we specialize. There's a difference between medicine as a medical knowledge and medicine as a medical profession or medical practice or the healthcare practice. And the better we can fill the gap between the medical science and the medical practice, the more we are on the right track. We should fill the gap between the medical profession and the medical science. If the gap between the medical knowledge and the medical profession is wide, so there is some problem. We are not on the right track. We should fill the gap between the medical knowledge and the medical profession or the healthcare profession, or the gap between what is studied in the school and what is in practice, or the gap between the research or the medicine as theory and medicine as practice. That is the clinical practice. We should fill this gap. And the wider the gap, the more is we are not on the right track. And the narrower the gap and the more we can fill this gap, the more we are on the right track as healthcare professionals or as doctors, physicians, and surgeons. So again, to confirm on this point, now I want to talk as on medicine as a medical practice, that is the medical profession, which is an industry by itself, the medical profession. And is it working in concordance with the medical knowledge or the medical science or not? This is very important. We all know that any qualified doctor should be professional in approach, should be professional in practice, and must be also safe in practice, must be professional in approach, safe in practice, and kind in attitude. These are the three requirements of any qualified doctor or medical doctor. That should be professional, should be kind, and should be safe in practice. This is very, very, very important. Safe in practice before being effective to his patients or to the healthcare consumers, as we say. So the medical practice, it is the basis and is the root of what we call the experience. Because the medical experience is as important as the medical knowledge. Both are the two arms of the medical practice. The medical experience, which we gain from practice over the years. This is very essential in order to be a good practitioner or a good healthcare provider in the healthcare profession, giving the best care to your healthcare consumer, who is the patient, as we call him. So, the medical practice. The medical practice, it is the basis of experience. And as we know, the experience is a wisdom. And as we say, knowledge is a power and experience is a wisdom. Knowledge, it is the medical science which we study in the medical school. And experience, this is what we get from continuous uninterrupted practice over the years in medical practice or in clinical practice or in healthcare practice. So this experience from over the years practice is the root of medical wisdom in clinical practice, so that you will be an understanding physician. Because the certificate which you get after being qualified, when you are qualified to graduate from the medical school, proves that you know, but it doesn't prove that you understand. It doesn't prove that you understand. In order to understand your case or your healthcare consumer, who is the center or the main focus in the triangle of the healthcare profession, is the patient, your patient, المريض. هو ده أهم حاجة في المثلث الرعاية الصحية. In the triangle of the healthcare profession, he is in the center. So in order to understand, you should have experience. And to get experience, you must practice. You must practice. You get it from over the year practice in the emergency room, in the OPD, outpatient department, in the wards, in the medical wards, in the surgical wards. They are the three components of any hospital. So I can for emergency room, for acute medicine, in the OPD for chronic medicine or chronic cases, and in the inpatient department, that is the medical ward or the surgical wards or other specialty wards inside the hospital. From this continuous practice, you will get experience. And the experience is the basis of the art of practice, because as I mentioned, the medicine is a science and an art. In order to get the art of practice, اللي هو فن الممارسة, you must have experience. You must have wisdom, medical wisdom. You must have common sense. Those are the three requirements. Those are the three requirements or the three elements from which are made the experience. These are the three requirements of medical experience for you as a medical practitioner, whether you are a general practitioner or you are a specialist or you are a subspecialist, it's consultant. So you must have experience, you must have wisdom, medical wisdom, you must have common sense. By these three together, you will have and you will acquire the art of clinical practice, اللي هو فن الممارسة الإكلينيكية. So to get the art of clinical practice, which as I mentioned, it is the second arm of medicine after science, after medical knowledge, after medical sciences, art. The art is formed of three important things, or is acquired through three important requirements: experience, wisdom, and common sense. And in fact, wisdom and experience, they are interconnected, because the root of wisdom is experience. So you can say they are two faces of the same thing, or two faces of the same coin: experience and wisdom. Experience is a wisdom. Again, knowledge is a power, and wisdom cannot be defeated by power, as we say. To have a knowledge, this is a power, قوة. And to have experience, this is a wisdom, حكمة. And as we know, the wisdom is half of the knowledge. أن الحكمة نصف العلم. هو علم في الصدور. And you can't get wisdom from your medical education. We don't teach wisdom in details or by terminology in the medical school. The wisdom, you will acquire it through your years of practice, through experience. So experience is the root of wisdom. That's why we say experience is a wisdom. Experience is a wisdom. And knowledge is a power. And wisdom cannot be defeated by power. I repeat again. Don't forget this. So the root and the source of wisdom, medical wisdom of the practicing physician or surgeon, to be understanding, because according to understand or you don't understand, you understand good or you understand poor, you understand bad. We classify doctors into good, poor, and bad. Not every doctor is a good doctor. Not every clinician is a good clinician. There are poor clinicians and there are bad clinicians. Depending on what? Depending on the ability to understand. And to understand is more deeper than just to know. As I mentioned in one of my live broadcasts on philosophy, on the philosophy of medicine and the philosophy in general. To understand is more deeper than just to know. So to understand, you need wisdom. You need common sense. And as we say, we have knowledge, but we don't have common sense in most of the cases. A good doctor should have a common sense. And this is a talent. And this is an innate talent to have a common sense. And to use the common sense when needed, in time, in the proper time, for the proper patient, in the proper situation, that is in the proper case, in the proper patient. So the time, the circumstances, and the patient, this is very important to apply the concept of common sense. So the physician should have common sense, should have medical wisdom, should have experience. Another important point is that to understand the wisdom, which will form or which is the result of your experience in clinical practice or in medical practice, you need to understand and to study and to know and to understand the philosophy of medicine, which is part and which is related to the philosophy of science. يبقى لازم تفهم فلسفة الطب عشان يبقى عندك الميديكال ويزدم ده. فالميديكال ويزدم يحتاج منك انك تدرس فلسفة الطب, philosophy of medicine and philosophy of clinical medicine and philosophy of clinical practice and what is the clinical logic, وما هو المنطق الإكلينيكي, and how you think logically in clinical practice and how you use the critical thinking to create and to get the clinical decision in clinical decision making. This is very important, critical thinking and using the clinical logic in clinical decision making. This is all through studying and learning the philosophy of medicine. So philosophy of medicine is needed for medical wisdom. Experience is needed for medical wisdom. And together, the medical wisdom or the wisdom and the common sense, you will get the art of practice. You will acquire the art of medicine. فن الممارسة الطبية, the art of clinical practice. So the art of clinical practice forms three things: experience, wisdom, again, wisdom, the medical wisdom, and the common sense. And wisdom through experience over the years in your clinical practice and through understanding the philosophy of medicine, and included in the philosophy of medicine what is the clinical logic and how to use critical thinking in clinical decision making or clinical decision formulation. This is very important and very pivotal in clinical practice. So this is the art of medicine. Together, art and science, you will be an understanding doctor. You will be a good doctor, not poor doctor or bad doctor. So this is very important to understand how you get the art of practice, how you acquire the art of clinical practice, how you be a good artistic doctor, how you be a good artistic doctor, يعني دكتور فنان زي ما بنقول من خلال التجارب which will develop and makes your clinical mentality and this is what we call the root of clinical mentality, العقلية الإكلينيكية. How to develop it and improve it. How to develop and improve your clinical mentality. This needs, and this is the art of medicine, the art of clinical medicine, the art of clinical practice. And here we come to a very important point in clinical practice, or in your practice of the medical profession, or in the healthcare profession, or in your professional approach as a doctor, which is how we approach the patient in clinical practice. Is it wisdom-based, or knowledge-based, or evidence-based? As we say now in the modern clinical medicine over the past 10 to 15 years, the evidence-based medicine, اللي هو الطب المبني على الدليل. Evidence-based medicine. Is it evidence-based medicine, or knowledge-based approach, or wisdom-based? It is mixture of the three. You should learn how to use the three in your approach to your patients, in your clinical approach to your healthcare consumer, who is the patient, هو المريض. فيجب أن يكون الكلينيكال approach بتاعك a mixture of the three: knowledge-based, wisdom-based, and evidence-based. And this is the most important, the evidence-based. But don't forget the wisdom, because this will give you the light and the skills of how to apply what we call the precision medicine, or the individualized medicine, or the personalized medicine, to apply the clinical rules on every case individually, because every case has a clinical phenotype. The details of every case different from case to case, suffering from the same disease. And this is the art of what we call the precision medicine. Here, the precision medicine. To use it, you should understand the wisdom-based approach. We should use the wisdom-based approach. And of course, after the knowledge-based. And then we come to the evidence-based, because the evidence-based gives general rules. And from the evidence-based medicine, we get what we call the guidelines. What are the guidelines for every disease in clinical practice? Guidelines for management of diabetes, type 1 diabetes, type 2 diabetes. Guidelines for management of intracranial space occupying lesions. Guidelines for management of headache. Guidelines for migraine. Guidelines for hypertension. Guidelines for heart failure. Guidelines for any disease. It must be evidence-based. But this gives general rules. But don't forget that every case has specific details. We call it the phenotype of the clinical phenotype of the case, depending on environmental factors, genetic factors, acquired factors, many things. Here we must use the wisdom-based. So it's not enough to only use the evidence-based, but you should also know how to use the wisdom-based approach, in addition to the basic, which is the knowledge-based. Evidence-based is important, but remember, which is the guidelines. But remember, the guidelines are general. Show me your patient, I will tell you the guidelines for this patient, and this is the personalized approach. Don't forget this in clinical practice, that the show me your patient, I will tell you the guidelines for this case, for this patient in particular, because the other guidelines, which are, for example, published by the American Association of Diabetes, or the American College of Cardiology for hypertension, for heart failure, for whatever in cardiovascular, or the European Association of the Study of Diabetes for diabetes, or these are different authorities which publish different guidelines, which are based on what we call evidence-based medicine. They apply which concept they apply to get these guidelines? The evidence-based medicine. But this evidence-based medicine there is no consensus about it throughout the world in the different medical authorities or the different medical foundations, that is associations and the colleges in any part of the world. So you find American guidelines different from Canadian guidelines, in spite of the fact that both are in North America. But Canadian is different from, in many cases, different from American guidelines in the same disease. In hypertension, you will find also European guidelines different, and the British guidelines, as exemplified by the NICE guidelines and the Scottish guidelines, different from the rest of Europe when published. So you find the European guidelines different sometimes from, or in many cases, in the same disease from the British guidelines. And these are the Western, American, Canadian, European, British. There is no consensus, مفيش إجماع about the guidelines for the same disease, for the same clinical problem. And you will find also guidelines in the East, Japanese guidelines, Chinese guidelines. But most of us are not oriented of this issue, that Eastern or Far Eastern medical guidelines based on evidence-based. Why the guidelines are different? Why the evidence-based medicine is different as published by the different medical authorities throughout the world, and why we should follow one school? For example, most of the doctors in the Middle East and North Africa use the American guidelines, for example. Less commonly, they use the European guidelines about the same disease. For example, in the management of hypertension, or in the management of diabetes, or in the management of bronchial asthma, or in the management of epilepsy, or whatever disease category. There are differences because of ethnic differences, because of geographical differences, because of social differences. So this is what we call ethnic or socio-ethnic differences. في أعراق مختلفة. And this makes, and of course the ethnic differences, they have different genomes. And the differences lie in the genes, in hereditary factors. So you will find that the response to disease and to medications, to drugs, different. They are all humans, but there are differences in the genes. There are differences in ethnicities, Afro-Asian, or Asia-Mediterranean, or Caribbean, or American Asian, or American African, or American Caribbean, or American Latino. These are different ethnic populations. The أعراق مختلفة, having differences in the details of their hereditary factors, that is genetic differences in the genome. And this makes their response to disease and to treatment of the disease, that is to drugs, different. So you'll find differences in the guidelines for how to manage the disease, how to treat the disease, due to social factors, ethnic factors, genetic factors, environmental factors. And this is related to geography. So we should understand the geographical medicine, جغرافية الطب والتوزيع الجغرافي للمedical problem, because this geographical medicine affect the response of the individual to disease and to treatment of the disease, that is to drugs, which we use them in clinical practice in therapeutic approach to different diseases. So you'll find differences in the clinical picture and in the therapy or in the clinical response to drugs. This is evidence-based. That's why the guidelines different. You can use the American guidelines inside America, inside the United States of America. You can use the Canadian for the Canadian population, but you can't use them in Europe. And you can't use the European and the American in the Middle East, because in the Middle East, the nature of the patient is different due to ethnic factors different. Social, geographical, environmental, these are called acquired. So the genes and which are non-modifiable, and the acquired factors, which are modifiable, including the social, including the environment, including the geography, are called acquired factors. عوامل مكتسبة. These affect the nature of the disease and the response of the individual to disease and to treatment of the disease. That's why here in the Middle East or in the Middle, we should have our own guidelines. We should not depend on the American guidelines, because the nature of the patient is different. It's geographical medicine نسميه أو طب جغرافي أو جغرافية الطب اللي هي زي هكرر تاني to repeat again why it is different, because of differences in ethnicities, in social factors, in environmental factors, in the nature of the genome of people in this area of the world. This is ethnic factors, geographical medicine. And this is what we call that's why the evidence-based medicine driven clinical guidelines is different. And in fact, show me your patient, I will tell you the guidelines. But this is very important to know, especially for the junior doctors and junior healthcare professionals, to know the evidence-based medicine and the clinical guidelines. Clinical guidelines come from evidence-based, depending on clinical trials and clinical studies, whatever the type of clinical trial, or because we have different types of clinical trials, as we all know, in clinical practice. How can we, or in clinical research, how can we understand this and to apply this? This needs the physician to understand, or the surgeon to understand. That's the medical practitioner or the healthcare professional to understand. But there are differences between clinical guidelines, between different parts of the world, or in the different parts of the world, between the East and the West of Earth, and in the West between the different schools or different authorities, American, Canadian, European guidelines, for the same, again, I repeat again, for the same disease. You should have an eye, you should study the clinical guidelines in different, or coming from the different medical authorities, the clinical associations and the foundations and the colleges which publish these evidence-based clinical guidelines. But you have to understand evidence-based, and you should approach your depend on knowledge-based, wisdom-based, and evidence-based medicine. And at the end, to apply the concept of precision medicine. Precision medicine. So, evidence-based and precision medicine, please. Any clinician should know how to apply evidence-based and to use the evidence-based medicine اللي هو الطب المبني على الدليل، بنسميه بالعربي in Arabic we call it الطب المبني على الدليل. Evidence-based medicine. يعني الممارسة الكلينيكية المبنية على الدليل. يعني في دليل، يعني في reasoning، يعني في clinical logic. لأن evidence is part of or is the result of reasoning, and reasoning is the cornerstone of logic, which is the most important mental process to get results or conclusions. Evidence, برهان، دليل. ولذلك it is طب مبني على البرهان أو على الدليل. علشان your approach should be according to clinical logic, according to evidence-based results, evidence-based conclusion, which we call it evidence-based medicine. That's why the juniors and most of us as also seniors should understand the evidence-based medicine and evidence-based clinical approach. But don't forget to be wise and use the wisdom-based approach also, and في الأساس the knowledge-based approach. Thank you so much, Professor Dr. Tarek Ali.